Hello, my name is Georgia McLendon. I'm a third year internal medicine resident at Houston Methodist Hospital. Thank you for having me. Today I'll be speaking about how cognitive impairment increases hospitalizations in some, but not all, chronic diseases. It is well established that patients with COPD, ESRD, and diabetes have high hospitalization rates. These diseases are also associated with cognitive impairment, but few studies have investigated whether there is a relationship between all three variables, namely the chronic disease, hospitalizations, and cognitive impairment. So we performed a literature review using PubMed and EBSCO Complete. The initial search yielded 1,133 abstracts, of which 7 abstracts were ultimately chosen for the final analysis. Here I have a table showing all 7 studies. At the top, COPD, the middle, diabetes, and the bottom, ESRD. The first COPD study by Chang found that patients with COPD and cognitive impairment had higher rates of both respiratory and all-cause hospitalizations compared to the COPD-only group, and though statistically significant, given that only 14.9% of the original sample had COPD and only 0.9% had both COPD and cognitive impairment, we determined that the study did not have enough power to support the argument that the cognitive impairment made the difference in hospitalization rates, but rather it was the underlying COPD. Doolahary and others found that there was no statistically significant relationship between their COPD patients' MoCA scores and their hospitalization utilization rates, and thus both COPD studies did not find an association. Moving to diabetes, Imini and others found that the incidence rate ratio of hospitalizations was up to 1.6 times higher in diabetics with executive dysfunction compared to patients with only executive dysfunction. Similarly, the incidence rate ratio of hospitalizations was 1.5 to 1.6 times higher in the diabetics with memory impairment compared to 1.3 to 1.4 times in non-diabetics with memory impairment. Raval and others looked at readmissions and found that diabetics with cognitive impairment had 15% readmission rates, whereas diabetics without cognitive impairment had 12% readmission rates. Sinclair and others found that diabetics with cognitive impairment had 17% higher rates of hospitalizations compared to diabetics without cognitive impairment, and thus all 3 diabetes studies found a significant association. Moving to ESRD, Jasinski and others created a cognitive impairment index and found that ESRD patients with higher cognitive impairment scores had 4.5 times increased likelihood of readmissions. Zhang and others found that ESRD patients with cognitive impairment had 7% higher hospitalization rates and 5.6 times a percent higher readmission rates compared to ESRD patients without cognitive impairment, and thus both ESRD studies found a statistically significant relationship. And so our studies suggest that although cognitive impairment is prevalent in patients with COPD, is not severe enough to impact healthcare utilization. In contrast, we found that cognitive impairment may impact hospitalization in patients with ESRD and diabetes. Limitations of our study include the relatively small sample sizes of COPD studies, as well as the fact that the severity of COPD was not clearly defined in all the studies. Additionally, studies compared used different methods of measuring cognitive impairment. However, one potential explanation for our finding may be that cognitive dysfunction in COPD may only become clinically apparent in the form of increased hospitalization utilization with severe hypoxemia. And thus, despite cognitive impairment's prevalence in chronic diseases, our study suggests that cognitive impairment may affect hospitalization risk more in some, but not all, chronic diseases, but more research is needed. Thank you all, and I hope you enjoyed my presentation.